Nevada's Republican governor, Brian Sandoval, is worried that people who make as little as $16,000 per year are going to lose their Medicaid coverage and not be eligible and be able to afford private insurance. Take a listen.
These are our friends. These are our families. These are our neighbors. They're living healthier and happier lives because of that decision. I don't think that can be overstated enough.
This is a Republican governor who is concerned that your plan would erode the lives of the most vulnerable. What's your response?
Yeah, it just wouldn't happen. And we're continuing to work with the governor to make certain that they understand and appreciate the plan in its entirety, the kind of waivers and options that we're offering states, the kind of extra resources that are going to be available for states to cover the most vulnerable. Look, I'm a physician. I took care of patients for over 20 years. The healthcare system that I'm supporting and will continue to support is one that actually responds to patients' needs, not just in Nevada, but in Pennsylvania and in Florida and Washington State and in Maine and New Mexico, all across this country. We've got a healthcare system, again, that's working for government right now, but it's not working for patients, and there's a better way to do this.
But let's just stay specifically on this question about Medicaid, because he's not the only Republican, actually both of them in Nevada are not the only Republicans who are concerned about Medicaid cuts. Just looking at the House bill, the CBO said that it reduces Medicaid by $834 billion.
Yeah,
is that not a deep cut?
Well, it all depends what you're comparing it to. The fact of the matter is the Medicaid proposal in the Senate bill goes up every single year that the plan's in place because it's based on the Consumer Price Index, initially based on the Consumer Price Index that's related to medical care across the country, and it goes up every single year. So it's important that people appreciate that what our goal is to make it so folks on Medicaid, the most vulnerable in our society, those moms and kids and the seniors and the disabled, that program works for them in a way that allows them to get the kind of care and the coverage that they need. In addition to those who are also in the vulnerable category, that they're able to get the kind of coverage that they want and need for their families.
Just to underline this, your position is that Republican Governor Sandoval in Nevada is wrong when he says his constituents, those who are the neediest, are going to lose coverage. He's not right about that?
Well, Dana, I know that's what that the division is what news wants to do. The fact of the matter is what we're trying to do is to bring people together.
Is he wrong?
And what I'm telling you is that the system, the plan that we would put in place would not allow individuals to fall through the cracks, we would not pull the rug out from under anybody, we would not have individuals lose coverage that they want for themselves and for their family. We want to make certain that health care is available to all Americans. Right now we've got 28 million Americans who are uninsured, who don't have insurance right now in the current plan. Is that a plan that works for patients? Absolutely not. That's the kind of thing we're trying to fix.